And speaking of the efforts to replace the Affordable Care Act, let's continue hearing how some citizens and healthcare providers see it. Producer Jason Kane visited a pair of clinics in the heart of coal country. Last night, we took you to the town of Wise, Virginia, in a state that opted not to expand Medicaid for low-income residents. Just across the border in West Virginia, the Affordable Care Act and its Medicaid expansion meant the rate of uninsured residents dropped from at least 21% before the law took effect to 9% in 2015. Now, nearly a third of families in the state do get Medicaid. More than 83% of Mingo County, West Virginia, voted for the president in the election. And the state has been ravaged by the opioid epidemic. But at the Williamson Health and Wellness Center, nerves are now on edge as patients recount their personal stories.
My name's Rebecca Hicks, and I'm from Chattelroy, West Virginia. I'm 37 years old. When I was younger, I was raped. I guess I got on drugs. Cope with it, regular pain pills. First, it started with, snorting the pills. Then it led to shooting the pills.
Hey, Rebecca.
Hey. And I've always struggled to have a doctor, and this place kind of takes care of all of it. My access to Medicaid has helped me pay for medicines that I would never been able to pay for, and to see specialists that I wouldn't be able to see if I didn't have that that medical care.
My name's Jerome Klein. I'm a family nurse practitioner. All right, let's listen to your heart in a few places. With the passage of the Affordable Care Act, the state had an expanded Medicaid programs. Right now, it's just under 50% of our patients, I think, are Medicaid.
My name is Vicki Hatfield. I'm a certified family nurse practitioner and a certified diabetes educator. Once we started seeing more patients qualify for Medicaid, they were able to come in and we were able to start getting them caught up on their preventive screenings and health promotion activities, and just be able to treat their chronic illnesses that had been neglected. The increased funds for Medicaid services brought more revenue into the clinic, so that allowed us to hire more people here. It also allowed us to do some other things in the community to promote healthy living.
We have a farmer's market every Saturday.
We also had community gardens start, and we see more people growing their own vegetables.
We have a 5K almost every month. And then we have a community health worker program. It's certainly a lot cheaper to keep people healthy at home than it is once they get into the system.
Now, as we watch what's happening with possible repeal or replacement of the Affordable Care Act, it's very concerning. I know patients are concerned, particularly patients who had chronic diseases that now they're able to get medications for, or patients who need annual screenings.
I got a head injury, I got a sleeping disorder, I've got back problems, I got knee problems, I have panic attacks.
What were you taking now?
Norco 7.5. My name is Connie Sue Mahan. We need the medical, and if they take it, it's going to hurt a lot of families in West Virginia. President Trump promised us a better plan, and we all voted to get him in there because we thought he'd do his country better. But if we ain't got that medical, we ain't going to have nothing. And that's how people in Mingo County live.
My name is Jerry Nell Taylor. I'm 58 years old. I have diabetes. You have to have the medication to keep the diabetes down. If you don't, you lose your eyes, your kidneys, and all that stuff, so I try to keep up on it. I started receiving the Medicaid after the Obamacare, the Affordable Care Act, or whatever it was called. With the care I receive here, my numbers have come down, my blood pressure, and they keep everything pretty much took care of for me, the mammograms and all the cancer screenings that I need. Affordable Care Act has helped me. It has hurt other people, especially people like my brother. It's hurt him, and he works hard, and then they take it out of his taxes because he doesn't have insurance. He can't afford the insurance under the Affordable Care Act. So it has hurt him. So if they drop me, they drop me.
Thinking about the possible changes to the healthcare system and the drive to save money with Medicaid, I'm not sure if there's an accounting of these people now seeking their primary care through the ERs. You know, when they can come here and the visit and pay a small copay versus going to the ER and all of a sudden it's a $2,000 bill.
About 2 years ago, I had been in a hospital, like in the mental ward for my mental health at least 25 times. And now I haven't had to be hospitalized for over 2 years because of all the doctors here that has helped me so much.
Especially now with the drug epidemic around here. What are we going to do with the people who have found an improved quality of life and they've moved beyond, you know, a life of addiction and we've got them into recovery? If we curtail that treatment, what potentially happens to those patients?
I would like to see the Medicaid expansion continue. I would like to see also a revision for some of the premiums. I have some patients who did not qualify for Medicaid expansion, but they also could not afford the premium and the deductible. I think that needs to be revisited. So I think that, you know, there are good parts of the program, but there are also some things that do need improvement.
I would tell the politicians that they might want to think real hard about it and throw the brakes on it for a little bit until they know more about it. Because what they're dealing with is if they take health care away from somebody that's an addict, they're going to resort to worser things. I chose those people. I put my faith in those people that they would make this place better, not take away the only things that were helping this area.